Hello, my dear students. Recently in latest videos, we had posted the previous question papers for Assistant Dental Surgeon exam. Just 2 days are left for the exam. So, all the best to all of you. We had received message from several students regarding how to write the exam. Those who are appearing for the first time, they wanted to know how to fill the OMR sheet, duration of the exam, and how to manage the time. Okay, and other than that, we also received message regarding please to make more videos on how to attend the exam with tips and tricks, etc. Okay, and directly with message also I had received, please tell me about last minute preparation. Please do a video on this, how to appear for the exam. So today we are going to discuss in short. Okay, there is no much time left for exam, so within 2 days you have to appear for exam. So let me explain very fast how to appear for the exam. Okay, first of all, you have to reach on time. So the exam time is 7 o'clock to 8:50. So you have the exact duration of the time is given in your admit card. The exam center is given. So download the admit card from the Kerala PSC website first. Okay, and three things only you can take for the exam hall. One is your admit card. Second is a ballpoint pen. It can be a blue or a black. And thirdly, you can take your identification card, that is Aadhaar card or voter's ID, whichever identification card you are taking it along with you. Okay, so better you take a Aadhaar card with you because all the latest photographs, everything will be available on the Aadhaar card. Okay, and it is linked to almost your number which you are using currently, isn't it? So better take a Aadhaar card with you. Okay, it's just a suggestion. Okay, if you have it ready, take it with you. So only three things you can take to the exam hall. So our exam duration is as given in the admit card, 1 hour 15 minutes. Okay, so we will have 100 questions and this will be the OMR sheet given to you. Okay, so this is the mock and giving. Okay, so this is exact OMR sheet you will be getting in the exam hall. Once you enter the exam hall, the first 20 minutes is for verification. Okay, so as soon as you enter at 7 o'clock, morning 7 o'clock, first 20 minutes is just for verification. Okay, the examiner will come to you individually. They will verify your admit card. They will verify your Aadhaar card or identification proof you have given. Okay, and they'll be also checking you if you have any things with you. They'll be asking to keep all the mobile phones, everything, electronic gadgets, everything you have to keep outside before you enter the exam hall. Okay, so please reach the exam center on time, that too at least 20 minutes before the time given. Okay, so by at least by 6:35 you be there in the exam center. Okay, because there will be clock room. In that clock room you will be asked to keep your bag, your all belongings. Only after going, you can go to washroom. Only after that you can get into the exam hall at 7 o'clock. Okay, clear? Now there will be OMR sheet will be given to you. You will be asked to write part A. There will be two parts. Okay, part A. So this is, I'm just putting this in the front part of the video just to explain how the OMR sheet and how to fill the OMR sheet. Okay, the examiner will always give you instructions in the exam hall. So always be vigilant. Listen to the examiner in the examination hall and only then proceed. Okay, be careful. Okay, then after this we'll be explaining the tips and tricks, last minute tips and tricks for exam. Okay, so watch till the end. Now part A and part B, there are two parts in this OMR sheet, isn't it? So first you have to, they'll ask you to fill the part A. So in the part A there will be different codes. There will be 4 codes, A, B, C, D. So this code is given as A in this particular OMR sheet. Okay, so if you might be receiving B, or you might be receiving C, or you might be receiving D. So what you have to check is, when you get the question paper, you have to make sure that the code which is given in your OMR sheet is exactly matching with the code on the question paper. Okay, suppose this is A, then your question paper code will be also be A. If this is B, the question paper also the alphabet B will be written. Okay, if it is C, in your question paper also it should be C. Clear? If it is D, it should be D in your question paper. So that is what you have to check. Then you have to enter. What you have to enter? You have to enter your register number. It will be given in your admit card. Okay, so you have to, there will be first there will be one alphabet and then there will be numbers. So that admit card, so everybody's register number will be different, isn't it? So that exact register number you have to enter from your admit card. Okay, don't make a mistake. And bubble the circles given below. Okay, bubble the circles given below accordingly. Okay, using a blue or a black ballpoint pen. Only ballpoint pen is allowed. Then you have to write your date of birth, okay, then year, etc. Then the name of the post for which examination is conducted. So in the admit card, it is given, clearly it is given as the examination for the post of assistant dental surgeon. Okay, so that exact detail you have to, assistant dental surgeon you have to write, and the category number also you have to mention. Category number is also given in the admit card. Okay, so that also you have to write. Then you have to write the date of the examination. Okay, the date of the examination is 28th November 2025. Okay, so you have to write 25/11/2025. Okay, if there is no change in the examination date. Okay, now there is a part B, isn't it? This part B. So in this part B, all the questions, 100 question OMR options are given. So only thing you have to do is you have to match with the question paper, the code you have received in the OMR sheet and the question paper is same. And then you have to start marking. Okay, once you get the question paper. So it will be like, you will be getting the question paper once the bell rings, and then you can start. Okay, then you can start filling the bubbles accordingly. Now I will explain the tips and tricks. Okay, I hope this is clear. Now there is a centermost part, there is a scissors given, isn't it? So at the end of the exam, the invigilator will ask you to tear the center part. Okay, you can tear it easily. You can tear it easily, and one you have to give it separately. Part A and part B, you have to give it separately to the invigilator. Okay, the main thing is you have to manage your time when you write the exam. Okay, now let me go to the tips and tricks directly without wasting time. Okay, so the most important part is you have to do the last minute revision. Okay, the last minute revision is very, very important. So how you will do the last minute revision? Here comes the tips. Okay, so firstly you have to combine the subjects and revise. Okay, first, so only 2 days, 48 hours are left. Combine the subjects, take dental materials and prosto textbooks together, revise it completely very fast. Okay, I will also mention I will be explaining which are the important topics in each subject also. Okay, so dental materials, prosto, you combine and you just revise fast because most of the topics are overlapping. Then you can combine ortho, pedo, ortho embryology and pedo conservative and endo. You can combine. Okay, if you want a screenshot of this, you take a screenshot while I'm explaining the video. Okay, so it will be easy for you to revise. So combine the subjects and revise in the last minute. Okay, so next, oral surgery, general surgery and general anatomy. Just combine the subjects, take all the 3 textbooks, revise. Most of the topics are overlapping. Okay, so better you take the standard textbook. Okay, standard textbook. If it is general anatomy, take Chaurishya. Okay, Chaurishya, and then open the textbook. At least you have the atlas with you. Okay, no need to go through the entire textbook. If you don't have time, take the atlas. Okay, atlas of general anatomy, BD Chaurishya atlas, and then go through all the pictures. Go through all the pictures given. Okay, osteology as well as all the anatomy, triangles, etc. Everything, all the triangles, especially muscles of mastications, everything you have to just look into the pictures. Okay, that is more important. Where is the origin? Where is the insertion? And then you also stress upon, if it is osteology, which are the structures passing through, which are the important structures. Okay, that is also important. Now, combine DADH, dental anatomy and dental histology, with perio and microbiology because most of the topics are overlapping. Okay, perio and microbiology, so many topics are overlapping. So just take the perio textbook and microbiology textbook, just revise quickly. Most of the topics will be, microbiology part is overlapping. Okay, clear? And most of the times they ask you which are the microbes and which disease. So you have to be vigilant about, or then take the textbook, go through all the tables. Okay, in perio textbook, you will be finding many tables, right? So those tables are very important. Tables, for example, which disease is caused by Porphyromonas gingivalis? Okay, in case of chronic gingivitis, which are the organisms present? Okay, so all these things are given in a table. Neatly it is given in standard textbooks. So that tables you have to go through, okay, in this last minute. Then you can combine oral pathology and OMR together, okay, because most of the lesions are overlapping in this one. If you have Berkey textbook, OMR Berkey textbook, in Berkey textbook, there are small boxes given in OMR, okay. I'm talking about oral medicine radiology Berkey textbook. In that Berkey, there are small blue boxes are given. So go through all those blue boxes, very important. Then if physiology and general medicine you can combine and you can study, okay. All the systems are important. Then pharmacology is also you can combine and study, because in each in this particular disorder, what is the medication given, what is the contraindication. Mainly you have to stress upon pregnant conditions, okay. Then pregnant mothers as well as lactating mothers, all those. If you have if the patient is having epilepsy, all those conditions, what are the drugs, emergency medicines and drugs. The topic is very important in pharmacology, okay. Clear? Okay. Now let me stress upon each of the individual subjects which I have not dealt till now, okay. Public health, stress upon fluoride, biostatics, indices, epidemiology, waste management and Caries activity test are very important, okay. Caries activity test, how many minutes are taken and what is the color change, okay, that is also important in Caries activity test, okay. Now coming on to pedo, you can go through child psychology, the names of those all the theories, okay, all the theories who has given which theory, that is very important, okay. So that you have to be thorough with. Caries, again Caries is repeating here. Child abuse is important, dental trauma, oral habits is important in pedo, okay. Oral habits, thumb sucking habit, lip biting habit, all this is very important. Then in case of pedo endo also you have to stress upon, okay. If it is an open apex, how do you treat, okay, which material you use. In case of pulpectomy, pulpotomy, all these things are important, okay. Then coming on to anatomy, okay. Anatomy, as I said, osteology, all foraminas, salivary glands are important in case of anatomy. And when you study the salivary glands, just look into oral pathology textbook also, which are the lesions coming in salivary glands, okay. The diseases, or if you have so many confusions, just look into our lecture, okay. Oral pathology lecture is given in eDental Formula playlist. Just look into all the lectures, just fast forward and see all the lectures. You will be able to easily recollect, okay. It is all pictorial, so it will be easy to recollect, okay. Or if you have the textbook, just look into the Schaefer's textbook, that is enough. Pharyngeal arches, venous and arterial supply, nerve supply, all these are important in anatomy. Microbiology, important topics are culture media is important, mycology, immunology, bacteriology, hypersensitivity, virology and sterilization. Sterilization is a very important topic. Sterilization, especially autoclave, dry heat methods, hot air oven methods, all these are very important. The duration, what is the color change, which material is used as an indicator, all this is important in sterilization, okay. I hope it's clear. Now let's move on to pharmacology, okay. Pharmacology, local and general anesthesia is important, okay. So you have to stress upon local anesthesia mainly, other than general anesthesia is also important, but LA is more important to us, isn't it? So local anesthesia dosage, the dosage is very important, how much weight, and the different formulas for calculating the LA dosage is important. Different formulas are given, that is important. NSIDs, okay, drugs on CVS, CNS and GIT, classifications, chemotherapy and mechanism of action of repeated, all these are repeated questions, okay. Mechanism of action. General surgery, if you go into, you will very important topic is burns, okay. Burns is very important. Wound healing, then fluid management. Shock is important topic in hemorrhage, arterial venous disorders and blood, okay. So just go through all these topics very fast, okay. Now coming on to cons and endo, obturation, surgical endo and the instruments. So all the file numbers are very important. Color coding of all the instruments are important. Newer instruments. Dental pulp, okay. What are the cells in pulp, very important. The layers, different layers. Traumatology, composites and different types of newer composite materials, okay, very important. Coming on to ortho, theories of growth, important topic. Cephalometry is important. In cephalometry, basic things are asked. What is a SNA angle, what is SNB angle, what is ANB angle, If it is more, what will be the diagnosis, whether it is class 2 division 1 or division 2, whether it is class 3. So all these things are important. Implication level. Okay, biomechanics, removable fixed and myofunctional appliance are also important. Okay, face mask is a repeated question in ortho. Skeletal maturity indicators, that is also important. Okay, and preventive orthodontics. Okay, now coming on to surgery, important topics are impactions, fractures and the treatment, orofacial and odontogenic infections, LA, again LA is a repeating, cyst and tumor, medical emergencies. So some topics are always repeating different subjects, so you have to combine and you have to just revise. Okay, the very best method is you take your textbooks, standard textbooks, go through the textbooks, mainly the tables and pictures. Okay, microbiology, culture media, mycology, immunology, bacteriology, hypersensitivity, virology and sterilization. Again sterilization is repeating. Okay, now coming on to pedo, behavior management. This one I explained once, isn't it? Behavior management, trauma and disorders of child. Public health I have explained already. Ortho I have already explained. Okay, so this is how you have to go through in the last minute. Take the topics, it will be easy if you go through these topics very fast. So I hope I have cleared this particular doubt from Vishnu Raj. Okay, how to appear for the exam. If you have any more doubts regarding how to appear for the exam, just comment below this video. I will explain to you. I will send an individual message. Okay, now how to do the time management, that is a very important question. Okay, so you have 100 questions. Okay, you have 100 questions. Listen to me carefully. You have 100 questions and the time given is 1 hour 15 minutes, isn't it? So what you have to, when you go through the, when you get the question paper with you, don't panic, don't stress. If you stress, what happens, you will forget everything. Okay, have a chocolate before entering the exam hall. This is my simple suggestion. Okay, let your hormones relax, make you relax. Okay, have one good chocolate before you enter the exam hall. A very good technique, have plenty of water also before entering the exam. So make sure you have the water bottle also with you. That I think that is allowed in the exam hall. No, I think exam water also will be provided there. So or you can take a water bottle with you, that is fine. Okay, now what you have to manage the exam. Once you get the relax yourself, you will be able to remember almost everything you have learned. Okay, only thing is you don't panic. Okay, when the question paper, when you get the question paper in your hand, the time starts then, isn't it? So what you have to do, you have to, if you are not able to, first read the first page. Okay, this is a simple technique. First read the question paper, check the full question paper, then you go through this entire question paper once. Go through this entire question paper once, and when you go through this question paper once, whichever answers you are 100% sure of, mark that answer, or you just make a small note in that question paper itself onto the side, a small dot, or you can put a small cross or something, some kind of any simple you can make yourself understand, and then write those, mark those answers in a OMR sheet first itself. Okay, so suppose if you know out of 100 questions, if you know around 50 questions answers, you know 100%. Okay, you can rule out all the 3 options and you know all the 50 questions. Mark those 50 question answers in the OMR sheet. Okay, because if you know the answer and if you are not able to mark it in the OMR sheet, it will be utter blunder, isn't it? So if you know the answer, first itself you go through the question paper. If you know 100% the answer of that question, mark that answer in the OMR sheet then and there itself. Okay, finish off marking. And whenever you are going through the question paper, suppose first question you know the answer. Okay, so you have put you are marking it directly in the OMR sheet. Now second question you don't know the answer, but you are reading the question and you can make out, you can rule out. Okay, either of the 2 questions you can rule, 2 options you can rule out. Okay, you have confusion between A and option A and D. Suppose you have confusion between option A and option D. So you leave that question, that at that first when you read the question paper, you don't mark the answer in the OMR sheet. Okay, don't mark. Okay, just mark in the question paper that you have to come back and you have to review it once more. Okay, clear? Then at the end, if you don't know the answer at all, please don't mark. Please don't mark in the OMR. Don't bluff in the OMR sheet, because the negative mark is very, very high. Okay, compared to NEET MDS exam, if you make a mistake, whichever mark you know, whichever question you have marked right, the answer will be from that your mark will be deducted. Okay, suppose you have got 50 marks. If you are making 4 questions wrong, then your mark will be 49. Okay, so if you don't know the answer, don't attempt the question in the OMR sheet. Okay, and if you can rule out option A or option D, make sure you mark maximum doubt questions, like at least you mark 10 questions maximum, 10 to 15 questions like that. Okay, if you are not able to make out, please don't mark the answer. Okay, please don't mark the answer. When you see the previous year's final rank list, the maximum rank the students have got is around 80, 85. Okay, the maximum mark is around 80 to 85. Okay, so the maximum rank obtained, the first rank holder has secured only maximum 80 to 85. And most of the times what happens is that some of the questions will be deleted from the question paper. Okay, in the final answer key there might be some errors will be there in the question paper, and final answer key, when we get if it is 100 questions are there, almost 10 or around 5 to 10 questions will be deleted from the Kerala PSC question paper. That is a usual thing happening in the Kerala PSC. Okay, so if you don't know the answer, please don't write. Okay, so that's my humble suggestion. Okay, it's better mark the answer if you're 100% sure, or you can make out, at least you have a rough idea. If you can exclude at least 2 options out of the given 4 options, only then you mark. Okay, otherwise it will be a big blunder. Okay, clear? And because the maximum score till now the Kerala PSC rank holders have obtained is only up to 80 to 85. Okay, please be sure about this. So don't be afraid, whether I have got only 60 questions correct, I have got only 70 questions correct, will I be there in the rank list? Don't doubt yourself. Sometimes the question paper will be very difficult. Sometimes the rank list, the maximum marks students must have obtained will be only up to 80. So don't doubt yourself. If you know the answer, just write only those answers. Okay, don't bluff in the OMR sheet, because negative marking is very, very important in Kerala PSC. Okay, I hope this part is clear. Okay, so this is how you have to attend your exam. All the best. If you have any more doubts, please don't stress regarding the exam. Okay, please don't stress regarding the exam. Just write down what you have learned. What if you're not able to recollect, don't stress yourself. Okay, all the best. If you have any more doubts, comment below the video. Okay, thank you, take care. I hope everybody will be able to utilize the last minute revision. Okay, 48 hours revision. Okay, thank you.